All right, so here we're going to talk about the communication requirement. So the two-way audio communication that the remote provider has to do outside of patient care time once a month in order for the CPT codes to be billable, right? That's one of the rules. So what is that conversation like, right? This remote provider is not the therapist. They're not treating the patient. They're not modifying the plan of care. They're really there the goal is increase compliance, improve outcomes, right? Knowing that 70% of patients don't do their HEP, what is the strategy? And so what I would recommend and what we do at MovementRX is we train our remote providers on motivational interviewing. It's a motivational interviewing focused strategy where we have this is a great book to read. There's one specifically for health professionals, but it really talks about motivational interviewing. It says there's really only three ways to talk with somebody. We can actively listen, which is where most people are. That's what they want. We can guide and we can inform, right? Healthcare professionals, there's a study that showed that within the first 7 seconds of a doctor's office visit, the doctor starts informing the patient. Most people are not ready to be informed. They are in either the guiding, they want to be guided, or they want to be just actively listened. So we have to realize that when we are calling patients or talking to them in person about this topic of, home exercise compliance, and we know the data, right? They need to know that we know what the data shows us, but that's informing. So, we it's important to let them know there's an accountability aspect, but motivational interviewing starts with, you know, asking the right questions, and the goal is to create internal motivation. And that's either going to start with actively listening or guiding the patient. And so an example of actively listening would be just simply asking them, I'm calling to check in with you. How's how's your physical therapy homework going? How are you feeling? Mainly, how's it going with your homework? Are you doing it? Are you spending time on it? And then just listen, right? Actively listening. And then when they tell you how it's going, a great strategy is to acknowledge and restate what they just said, right? Just repeat back to them what they said. And if you can label that, like label how you think they're feeling, and then stop and then let them say more, that's a great strategy too. And what that does is that gets you into the next step, which is hopefully guiding the patient, right? You're kind of opening up the door, you're building trust. And, but it starts with asking the right questions. And then, accountability is the main goal, but I think when we're trying to get somebody internally motivated, I think it's important if we ask like future implication questions. So, asking them, tell me what are some things that you would be able to do if this pain or this problem went away in the future? What is life going to be like when this goes away for you, right? So then let them tell you what that's going to be, and then acknowledge and restate that. And then we can start to guide or a little bit of informing by saying, well, based on what you're doing here, the therapist really believes that these things they're teaching you are going to help you get to that goal. And so it's really motivational interviewing. It's an important conversation, and it's really difficult. And the reason why this program even exists is because most therapists aren't very good at it. Most physical therapists struggle with these difficult conversations and holding people accountable, because guess what? It feels like confrontation. And it feels awkward, and most healthcare providers are non-confrontational. And so that's really where this comes in, and it's a skill to learn. And this is how we try to train our remote providers to ask questions, not just inform them. Well, I can see you're not doing it, so do it better next time. That's not going to help. We have to just have conversations and hear what they have to say, actually listen, help them think about the future, reassure them, encourage them. Well, there you go.